Hello again. It's early February in 2022, and we're here to do another installment in COVID updates. Last time we talked about childhood vaccinations, and now we have Omicron and a pending transition to an endemic phase and some semblance of normalcy. With Omicron, if you've been vaccinated, for the vast majority of people, this virus is fairly benign. I had it myself a number of weeks ago. Lots of people in the community are getting it. Very few are getting significantly ill. Now, if you're immunocompromised, you've got some sort of autoimmune disease, you've got cancer, you're on chemotherapy, that's a different story. But for the vaccinated, healthy individual, this is largely an inconvenience. People are, stuck at home for a little bit, trying to keep others from getting sick, and they don't feel great. I've had a lingering congestion that doesn't want to go away, but by and large, you continue on normal life. If you're not vaccinated, there is still significant risk. If your immune system is compromised, there is still potentially significant risk. But a lot of that was true with other illnesses like influenza anyways. The process by which Omicron has moved through the state has resulted in us getting to a point now where essentially everyone has antibodies. You either got vaccinated or you've had COVID-19 or both. And subsequent to that, moving forward, most cases of COVID-19 are going to be fairly mild. It's everywhere. And so identifying, who had contact with who is becoming increasingly less and less valuable. What's going to matter is, are you actively sick? Do you have a fever and are you coughing? If for no other reason than a matter of kindness. You don't want to make your neighbors sick. You don't want to make your coworkers sick. Of course, the future is a difficult thing to predict, but this is looking like it's going to be similar to influenza, where COVID-19 is not going to go away, and in every town there's going to be the occasional death, similar to influenza, and we can't completely ignore it, but it doesn't affect our lives on a daily basis. Moving forward, there's a lot of people worried about, well, what about the next variant? And a lot of that we don't have to spend as much time worrying about as we did. We're in a much different position than we were a couple of years ago. We understand COVID, we understand what it does, how it acts, what to worry about, what to do about it. And those are things that we didn't know a couple of years ago. We're now in a position where a very large percentage of the population has some degree of protection against COVID. That wasn't the case a couple of years ago. We're in a position where the pharmaceutical companies have the ability to produce a new vaccine in 100 days to go from new variant to distribution, which is shocking, but an amazing protection for our society. We've got a new antiviral, Paxlovid, which, because of the way it acts, isn't really affected by new variants in the spike protein. It'll still work. And so we're in a place where we can be a lot more comfortable. Now, saying that and being more comfortable are pretty markedly different things. There are a lot of people in the last couple of years that have been pretty afraid, and rightly so. Early on in the pandemic, there were overflowing hospitals and refrigerator trucks in New York acting as makeshift morgues, and we told everybody to stay home and shut down a lot of businesses. And reversing that and saying it's okay now is going to be a long sell. People are not going to be all ready for this. Of course, there are going to be people that were ready to go back to normal, a month ago, a year ago. But there are people that are going to continue to be careful about their social interactions. People are going to persist in wearing masks. There's going to be some permanent changes. If you think about other existential events in our culture, 9/11, air travel was never the same after. It used to be not so painful. Well, it's different now. I anticipate we'll see things like persistent masking for clinicians in hospitals. Last year we didn't have a flu season. Why? Because social distancing and masking work, and we have a responsibility here in hospitals to do everything we can to protect our patients and keep them safe. So our clinicians are probably going to be wearing masks for the foreseeable future. Not going to be the case for the average person out in the community. You may choose to if you are high risk or immunocompromised, but it's going to be much more individual choice. You're going to get much less weigh-in on the part of different governments as they relax. And I expect a much more normal summer. The at-home tests were also in quite a different place than we were a couple of years ago. Antigen tests that we have now versus a couple of years ago are very precise. There was a study that was done down in Massachusetts, and the sensitivity and specificity were in the 90s for adults. They're good tests, and they work well if you follow instructions. And if you've been exposed to COVID or you've got a cough and a fever and it's positive, you can rely on that. You don't need a PCR backup. It's not necessary. It's kind of a nice position for the community to be in, where there is increasing ability to make these diagnoses at home. Because for a lot of us, almost all of us, COVID-19 is a significant inconvenience, but nothing dangerous. And so we can make that diagnosis at home. We can self-quarantine because we don't want to make our neighbors sick, and we can get back to work after 5 days or your symptoms have passed. We don't need to go to the hospital. We don't need to be clogging up clinics, so that they can confirm that and send you right back home. And that's a pretty significant advancement in medicine. I expect somewhere between Valentine's and St. Paddy's Day, we're going to have a relatively low sustained number of cases here in Vermont. Subsequent to that, as the hospitalizations dwindle down, it'll take a little bit longer. It takes a while for people to get sick and then be hospitalized, and hospitalizations with COVID are slow right now. You can't take a COVID positive patient and put them in a nursing home even if they're better. You can't put them in a psychiatric facility even if they're better. You've got to wait. So it's going to take a little bit to decompress from a hospital system standpoint. Subsequent to that, we're going to have to see officials in businesses, schools, governments get comfortable with our new reality. When are they going to relax various restrictions? And there's going to be different phases that different entities move at, depending on how nervous they are. You're going to see some schools go without masks sooner than others. And on both sides of the aisle, you're going to have people say that it was too slow or too soon. It's going to be a slow process for all of us to get comfortable with the new normal again. But as I said, I expect that we're going to be in a better place real soon, that the healthcare system is going to be considerably less stressed in regards to COVID itself. We still have our workforce issues to deal with, but it'll be a good place.